We've spent a lot of time talking about, hearing from you about, of course, what's going on now with Quebec doctors, medical specialists, the pressure tactics that have been applied. Now the government coming out and actually just this morning meeting in special session to basically tell family doctors in this province it's our way or the highway. But before we get to that story more in depth, I want to go to a story that I came across the other day on CTV concerning a doctor who would like to practice here in Montreal, who was originally from Montreal and is running into nothing but wall after wall. Listen to the beginning of this report.
And is a geriatrician who up until recently was working in Boston. For 2 years, she's been trying to work in Montreal, but she's had no luck. Anderson was raised in Montreal, went to med school in Toronto, but completed her residency south of the border, along with several specialized fellowships focusing on dementia care and geriatric neurology. It took 8 years of training, but she says it feels like she would need to start over if she wants to work back home in Montreal. In a response to CTV News, the Collège des Médecins du Québec said it is currently working to make the path easier for medical graduates from the States to come work in the province. But for now, doctors like Anderson still have to go through the lengthy process.
That doctor like Anderson, it refers to Dr. Diana Anderson, who is a board-certified internist, geriatrician, and a healthcare architect. Yes, she's from Montreal, and she currently lives in Montreal, but is having, as you heard in that report, a very difficult time trying to help out in a system that so desperately needs doctors. She is on the line. Dr. Anderson, thanks for being with us this afternoon. We all know there's a shortage of doctors here. You know, you're a board-trained doctor. You're originally from here, which you'd think would make things even easier. What's the hurdle, or what are the hurdles you've run into so far?
Yeah, no, there's been quite a few. And actually, I should say that I did try to return at various time points prior to the last 2 years, so even prior to the COVID-19 pandemic. And I think it was at least my hope that it would be getting easier at this time. I think the hurdles are really about the fact that, you know, the system hasn't been updated in many years, and reciprocity between the two countries is challenging. I think it's always hard to change locations if you have a professional designation like medicine, architecture, law. That can be tricky. But you know, I think this pandemic has really changed the world, and we're looking at a huge wave of globalization and technology, making it easier in some ways to cross borders. People are wanting to cross borders more often. The U.S. has certain advanced fellowships, so one big challenge is that system where they're not necessarily accredited in a formal way. So, for example, I did a 3-year advanced geriatric neurology fellowship in Boston, which focused on dementia care, providing it, prevention and treatment, and also conducting research. Well, that isn't recognized here, so those 3 years go unrecognized. There's also different lengths of residency and fellowship training. For example, clinical geriatric medicine in the United States is a 1-year fellowship, and here it's 2 to 3. So there's a few discrepancies, but I should say that unlike law and other disciplines that differ by area, the human body and our physiology and disease states are the same, right? So dementia looks very similar in Boston as it does here. So I believe we should be developing ways to make it easier to actually cross the border and return if Quebecers want to come back to practice.
You know, it's interesting as I hear you say that, I can't help but think back to a couple of cases, and we've, I think over the years, talked about this. Like I ran into someone who was, from example, I think from Russia at the time, fully trained, educated, university degree as a doctor, and the hurdles he ran into here, but he was from halfway across the world. You're literally from just across the border in the United States, and I understand the programs may be different from one side of the border to the other, but you'd think there would be some kind of way to recognize the education and work you've already done and simply make the transition to be able to come back to what is your home a little easier, but that's not even close to being the case.
Yeah, I think that's true, and I think many people don't realize that. There's always a focus on bringing in foreign doctors, you know, to train new physicians. It takes a long time. If we start with medical students here, medicine is a long, long road. And obviously, if you bring in foreign citizens, you have to deal with visas and citizenship complexities. But there's a host of physicians like me who are Canadian citizens, even Quebec residents who speak French and English or other languages that we desperately need. So bring them home. It's a no-brainer.
Is it worth pointing out, I wonder, you just brought up language. Was language or is language an issue with respect to French for you?
Yes, it is an issue. It does add to the complexity.
Okay.
So I believe, but we would need to fact check. I would likely need to take a French exam. I did grow up in Quebec in Montreal. I did go to English school with a focus in French immersion. But I believe I would need to take a French exam and possibly do some work in French.
Mm-hmm.
Now, that's obviously a hurdle. I've taken many exams in my life. I'm not interested in trying to take more. And I certainly think if you're put into a position of practice to practice French skills that are there, one could catch up.
Right. You're not averse to doing that if that's part of what it takes to get back.
Right, not at all.
Okay, so let me ask a couple of things. Number one, you're back here now. You're living in Montreal despite having to go through all these challenges to try to do what you do, to practice your profession here. You're back here already. Now, what happens next for you? You can't practice here, so what do you do?
Right, that's a good question. So I've actually been here for just over 2 years. My family is here. I have 2 aging parents. I have a young child. I'm a single parent, so it made sense to come back to where I had support. And I've traveled and lived in many big American cities. I even went overseas and lived in Australia. But right now, Montreal just feels right for this phase of my life. I actually have I'm sort of a professional student. I guess I love taking exams, but not only am I a physician, but I'm also a licensed architect. I did several architectural degrees at McGill University, and I'm licensed here with the Order of Architects of Quebec. But then I also did some specialized training to become a board-certified healthcare architect, meaning I design and build nursing homes, clinics, and hospitals. And so because I can't practice clinically,
right,
I do that instead at the moment. And I've always wanted to develop a career that's actually multifaceted, where I see patients, I also conduct some research, but then I work in private practice. I think it's important because I don't know if listeners are aware, certainly the social determinants of health after COVID are very much publicized, right? We wouldn't argue that diet, geographic location, cultural background can impact your health long term, but the buildings that we live and play and go to school in and work in, they're actually medical interventions. They actually affect our brains and our bodies. So there's a whole area of research that I look into as to how that occurs and why, and how we can build more efficiently to improve patient care, staff delivery, and even help costs.
Now that your story has gone public, it's interesting. You say you've been here for 2 years. And of course, I think most people were just made aware of this fact 2 days ago when they saw that story on CTV. Have you heard from the Collège des Médecins? Has someone reached out to you or anybody about your situation?
No, I've heard nothing except a lot of people who I guess watch CTV News and hopefully listen to CJAD and have sort of expressed sympathy and frustration saying, this makes no sense. What can we do? So my hope is that this story can bring some visibility, but I would love to be contacted. And I think that I bring a unique skill set, an architect, a physician, a geriatrician. Surely there must be something I can do in Quebec, because right now all the work that I do is outside Quebec borders, and I would love to actually contribute to Quebec society.
Can't you imagine all the people sitting listening to this, shaking their heads, going, here's someone who's qualified, overqualified in a province that so badly needs doctors, and you can't even practice your profession here. I mean, it literally is incredible to think about in the worst possible way. I hope that something does come of this. With respect, if I can just ask you, so you obviously follow what goes on, with respect to Bill 106 and the pressure being brought to bear by the government on doctors, maybe I have to ask, would you really want to be part of that given what's going on?
That's a loaded question for sure. I see a lot online, personal anecdotes from my colleagues in clinical medicine. It's hard. I think that it's very conflicted right now, and I've paused actually. And certainly this week, I sort of said to myself and my family, has said, what are you doing? Why do you even want to stay here? But for me, it's very important. And hopefully we can try to improve the system and deliver care. I see the need for geriatric care in this province. It is woefully lacking. We need more geriatricians. We need more clinicians in nursing homes. We need more memory clinics to look at dementia care. But I'd like to say, obviously, if I can't, I would consider, and I have considered leaving for other areas in Canada. Other provinces have really thought about this and made it much, much easier for U.S. board certifications to be utilized here. There is a little difference between community medicine and academic medicine. So I'm very interested in staying academic with a professorship here, not in Boston, where I currently hold a title. But I'd also like to conduct research. And I should say I have research grants, so I'm given money. I can bring it here, but I've consistently been told, no, we don't need that. We don't need research money. This isn't of interest right now, which always boggles my mind.
And I think everyone else's mind's listening to this. I am out of time. I thank you so much. And I mean, I hope this all works out. Maybe we can touch base a little while from now and maybe there'll be some good news to report. At least we can hope for that. Thank you so much. Really appreciate your time today.
Thanks very much.
The biggest songs in the world. You've heard them countless times. Now, learn the details of how they came to be. Join Ruby Carr for Encore, the stories behind the songs you love. New interviews and newly unearthed archive footage make for a fascinating weekly deep dive. Stream Encore, the stories behind the songs you love on iHeartRadio or wherever you get your podcasts.